Hello, my name is Nicole Torios and I will be your medtech for today. So here's a sample that was recently brought in the laboratory and is attached to a histopathology request form which states information such as patient hospital number, patient's full name, date of birth, gender, specimen type, test requested, consultant who requested the test, date and time of the specimen collected. First, we need to check if the test is really for us. In this case, it is a histopathology request form. Then, we have to check the sample's integrity. For example, if the container of the specimen is broken or anything. Next, we have to check if the sample corresponds with the form. We need to check the patient hospital number, patient's full name, date of birth, gender, the date and the time collected. In this case, it is a match. In case of mismatch, for example, when the name of the specimen does not correspond with the name in the form or when we receive an unlabeled specimen, if the specimen is an easily repeatable specimen, we will reject that and ask for a new one. But if the specimen is not easily repeatable, we would call the ward and ask them to authorize if the sample belongs to that patient. Next, we will assign a serial number to the sample. SP, since it is a surgical pathology, 21, the year 2021, 120, the specimen control number, which is the 120th specimen. And here you will see the serial number of the specimen. Before processing, we need to write all the details in the logbook. The patient's hospital number, the patient's full name, the serial number, age, gender, room number, specimen type, the pathologist who will examine the test, date and time of the specimen collected, and the due date. After writing in the logbook, it is now ready to be examined. This time, I will be teaching you how to make paper boats, which can be an alternative for tissue cassettes. First, we fold it 3 times lengthwise as well as 3 times crosswise. By now, we have 9 boxes and we now fold the corner boxes and let the perpendicular lines meet. The 4 flaps will now be folded towards each other and the resulting flaps will be folded outwards. And now, we have an improvised cassette for our specimen.
Hello everyone, my name is Jericho Stanio and I'm your medical technologist for today. So, I will be showing you the different methods of fresh tissue preparation. Of course, we have tissue organization, squash preparation, smear preparation, and touch preparation. And now, let us move on to our materials. After slicing the block of tissue in the cryostat, immerse the tissue slices in a glass bowl filled with normal saline solution. Using a dissecting needle, carefully tease the tissue slices until they unfold and spread out. Then, carefully mount a T-slice on a slide and cover it with cover slip. The first step is to pour a small amount of the sediments using a syringe on one end of a clean glass slide. Using an applicator stick, streak the sediments in a zigzag line throughout the remaining length of the slide until uniform distribution is obtained, and cover it with a cover slip. And lastly, label your slide with your name, group number, and section. The first procedure is to transfer a small amount of the sediments using a syringe and place the drop at the center of the slide. Using an applicator stick, gently spread the sediments at the center with a circular motion. Then, label your slide with your name, group number, and section. From the fourth step of the previous procedure, add 1 to 2 drops of methylene blue stain directly on the tissue slice on a glass slide. Then, cover the stained tissue with a cover slip or another glass slide. Next, apply enough pressure to crush the tissue flat. And the last step, don't forget to label your slide with your name, group number, and section. The first step, in pull apart, place a drop of sediments using a syringe at one end of a glass slide. Cover it with the end of another glass slide and pull the two slides apart in opposite directions. And cover the smear with a cover slip. Then label your slide with your name, group number, and section. In touch or impression smear, we should retrieve the block of tissue from the first procedure and cut the block in half, exposing the fresher surface, and allow the freshly cut surface to come in contact with the surface of a clean glass slide and apply gentle pressure, allowing the cells to be transferred directly to the slide. And cover the smear with a cover slip. Then don't forget to label your slide with your name, group number, and section.
Hi guys! Congrats! You have already reached the third part of the video demonstration for our histopathology. So I will be your next mentor / medtech for today. I am Sheila Castillon and I will be demonstrating to you the steps on how to accomplish manual fixation. So fixation, this is the first and most critical step in routine tissue processing. Our main goal here is to preserve the morphologic and chemical integrity of the cells in our tissue in as lifelike manner as possible with the aid of our fixatives. So these are the needed materials for our third activity. So shall we start? Firstly, we are going to need a 500 ml beaker, our tissue sample, a chopping board, a knife, our tissue cassette, a ruler, and for our chemical, we have here the 10% formalin. We are going to do the gross examination. We will note its color, texture, size, consistency, and any remarkable characteristics that is displayed by the tissue. Take note that this can only be done by the pathologist. However, there are also times that medtechs who were trained in histopathology can do the gross examination but are only limited on small specimens. Remember also to never ever touch the specimen if the pathologist or assigned medtech was still not able to perform gross examination to the tissue. The tissue specimen is brownish in color. It has a rough texture. So for the size, it has a length of 5.5, a width of 3.5, and a height or thickness of 2 centimeters. The tissue is intact and it has a bloody area in its bony part. When we are done with the gross examination, images of the tissue are usually taken, which will be included in the patient's report. Next, we will choose a representative specimen by using a scalpel or knife. We need to cut it into 2 centimeters squared but not more than 4 millimeters in thickness. This is done so that the tissue specimen will be able to fit in our tissue cassette later on. If thickness exceeds 4 millimeters, then we will not be able to close the tissue cassette. After this, we will put the specimen in our tissue cassette. We need to write our name or code and attach it inside the cassette. You can also just label the plastic cassette with a pencil. Remember to use pencil in writing because it will be exposed to different chemicals, and chemicals might erase the pen's ink. So in the next step, we will fill the 500 ml beaker with 10% formalin up to the 400 ml mark because the tissue to fixative ratio must be 1:20. Also, formalin is a type of fixative which is produced by adding water to the gas formaldehyde. This preserves the tissue by forming methylene cross links through binding with the amino groups of the tissue. Finally, we will submerge now the tissue-filled cassette into the solution so that the tissue will be exposed to the formalin. By the way, formalin, it can penetrate to the tissue rapidly, which is about 1 millimeter per hour. Since we only have a small tissue specimen here to be immersed in the fixative, the duration of fixation will be shorter since fixation of formalin is dependent on the thickness of the specimen. Take note that as medtechs, we are responsible on making sure that our fixatives or chemicals that we use are fresh and free from materials or foreign materials that may interrupt with the visualization of the specimen under the microscope. Now, we will cover the beaker and label it with our group number, which is group number 5 and section 2D. Send it to the laboratory for storage until the next laboratory session. So that would be all, guys. I hope you have learned a lot from this video demonstration of the manual fixation. See you soon!
Hi guys, I am Trisha Marie Junio, your medtech for today. This time, we are going to do decalcification. Decalcification is the process of removing calcium ions from a bone or calcified tissue for them to be flexible and easier to cut for pathological investigation. Decalcification is an optional step done after fixation and prior to dehydration. So these are the materials needed for our activity today. For the materials,
We will be needing a gauze pod, chicken leg bone, stick, thread, beaker, and the most important material is the decalcifying agent. The principle of decalcification is quite simple. We just need to remove the substance that makes the bone hard, and that is the calcium. For the first step, prepare all the materials needed. Second step, pour a liberal amount of dehydrating agent into a 500 ml beaker. Third step, place your selected pieces of tissue in a gauze pod. Fourth step, suspend your tissue in the decalcifying agent by means of a thread to ensure complete decalcification and to protect the tissue from any precipitate that might be settled at the bottom of that container. Did you know, in the actual procedure, the thread used in this method should be dipped in a melted paraffin wax to avoid the destruction of the thread by the corrosive activity of the acid. Fifth step, allow the tissues to decalcify for 12 to 24 hours.
After 12 to 24 hours, you can actually test the extent of your decalcification process using various methods. It could be for physical or mechanical tests, chemical tests, or X-ray or radiological tests. Using these various methods will help you determine the endpoint of your decalcification. This would be all for our manual decalcification process. Thank you so much.
Good day, everyone. I am Lucille Therese G. Mordeno, your registered medical technologist for today. Now, we are going to perform manual dehydration. So, what is manual dehydration? Manual dehydration is a process of removing extracellular and intracellular water from the tissue. Now, I am going to show you the materials that will be needed.
So first is 70% ethanol. Next is 90% ethanol. And next is absolute ethanol or 100% ethanol. And next is our tissue specimen with tissue cassette for the suppression of our tissue specimen in the ethanol. Next is forceps. And lastly is our foil. So, the first procedure in manual dehydration is to immerse your sample in 70% ethanol. And leave it for 15 minutes. After 15 minutes, we are going to transfer our sample in 90% ethanol. And leave it for 15 minutes. After 15 minutes, we are going to transfer our sample in 100% ethanol. And leave it again in 15 minutes. After 15 minutes, we are going to transfer our sample in another 100% ethanol. And leave it again for another 15 minutes. After 15 minutes, we are going to transfer our sample in another 100% ethanol. But this time, leave it for 30 minutes. After 30 minutes, let's transfer our sample in another 100% ethanol. And leave it for 45 minutes. Finally, after 45 minutes, wrap your sample in foil and fold it. And for the last procedure, store your sample, and this tissue sample is now ready for the next tissue processing.
Good day everyone! Welcome to the Histopath Laboratory section. I am Joshua B. Sales, your histotechnologist of today. Today, I will be performing the clearing process, which is part of the tissue processing. Clearing is the process whereby dehydrating agent is removed from the tissue and is replaced with a substance or clearing agent that will dissolve with the wax that will be used in impregnation. The purposes of the clearing process are to increase the refractive index of the tissue. With this, we can easily identify tissue structures which will be helpful in the tissue study. Number 2, to facilitate the penetration of embedding medium, which is the wax.
The materials needed for this clearing process are tissue specimen, forceps, paper tissue, foil, and most importantly, silene. We will be using silene because it is a rapid clearing agent that penetrates within 15 to 30 minutes. It has a high refractive index, it does not affect staining, and it is highly volatile. It evaporates rapidly in the oven, thus it can easily be replaced by the melted paraffin. Tissue specimen is immersed in the first container of silene within 20 minutes. It is important to take note of the time because prolonged immersion of it will cause for it to become hard and brittle. After 20 minutes, transfer the tissue specimen in the second container of silene. Keep in mind that we use forceps for us not to have skin contact with toxic chemical agents and for us not to contaminate the tissue specimen. Again, after another 20 minutes, transfer the tissue specimen in the third container. This is the last immersion of the specimen in the silene. It is to be immersed for 45 minutes. After 45 minutes, take the tissue specimen out of the container. Place it in a paper towel for it to drain and dry properly. After draining the tissue properly, place it in the foil. After it has been placed in the foil, wrap it properly and store it for the next tissue process.